The future without antibiotics. A frightening scenario. Imagine a world where a simple infection, like a poorly cleaned wound or a urinary tract infection, becomes deadly. This isn't science fiction. It's what could happen if we keep using antibiotics as a universal solution for every ailment. Antibiotic resistance is on the rise. And if we don't act now, we could return to a pre-antibiotic era, where even minor infections meant certain death. This reality is already emerging in some parts of the world. Do you know what the biggest problem is? We can't outpace how quickly bacteria adapt. Every time we misuse an antibiotic, it's like handing bacteria a weapon to defend themselves better. And when antibiotics stop working, we're left defenseless. This is why it's a global battle. Don't think this is just your problem. It's everyone's problem. Hospitals are already dealing with resistant infections that require months of treatment and cost thousands of dollars. But what does it mean for you? An infection you might treat today for a few euros could end up costing your health, your peace of mind, and, in the worst cases, your life. We can't ignore this reality. Antibiotic resistance is like a wildfire. It spreads and affects everyone. One person using antibiotics without a real need increases the risk for all of us. It's a shared responsibility. Don't ignore your body's signals. There are infections that your body can perfectly fight on its own, especially viral ones. Every time you choose to wait, hydrate, and rest instead of rushing to take a medication, you're doing your body a favor. You're letting your immune system do its job. Antibiotics aren't a magic cure for every symptom. Do you have a fever? It might be your body fighting something off. Do you have a cold? There's nothing an antibiotic can do. Every symptom has a cause, and not every cause needs medication. Remember, the less you use antibiotics when they aren't needed, the better they work when they truly are. The role of doctors and pharmaceutical companies. No. You're probably thinking, but isn't it the doctor's job to know this? Isn't it their responsibility? In part, you're right. But let me tell you something. Doctors are human too, and sometimes they're influenced by routines, pressure, or even pharmaceutical interests. Not every prescription is based on thorough evaluation. Some antibiotics are prescribed just to play it safe or to satisfy anxious patients. Pharmaceutical companies don't always help either. Aggressive promotion of drugs often leads to increased and unnecessary consumption. That's why it's so important for you, as a patient, to be informed, aware, and ready to ask questions. Don't passively accept every prescription. Always ask, is this really necessary? Is it actually bacterial? A message to everyone watching this video. I don't want to scare you, but this is the truth. Antibiotics, when used without a real need, can harm your body and contribute to a global problem. It's time to change how we think. Use antibiotics only when there's a clear diagnosis, and never give in to the temptation of self-medicating. If you're unsure, ask questions. Being informed isn't an act of defiance, it's an act of responsibility. Every choice you make today impacts your future and the future of the next generations. So the next time you think about antibiotics as a quick fix for any ailment, stop and reflect. Is it really worth the risk? Antibiotics are a powerful weapon. Use them wisely, not against yourself, not against the world. If this message made you think, share it. Someone might need to hear it right now. And remember, your health is your most valuable weapon. Protect it with smart choices.